President Uhuru Kenyatta now says every coin that has been allocated to the fight against the coronavirus pandemic will be accounted for, accusing those claiming misappropriation of funds are jumping the gun. This as Health Cabinet Secretary Mutahi Kagwe defended the planned 1 billion shilling expenditure by the ministry, saying every allocation can be justified. And as Sam Gituku reports, ministry's senior officials are now claiming that not all the money has been released to the ministry.
It's only been 2 months for the now arguably most visible cabinet secretary since he assumed office. The magnitude of the fight against coronavirus campaign requiring increased funding, with many philanthropists and donors directing their portions to the fight. The Ministry of Health has already attracted 6 billion shillings from the World Bank, of which 1 billion shillings has already been budgeted for. The Ministry of Health now stating that the money has been spread out for 6 months till September. The bone of contention being the elaborate spending in what would appear to be non-essential and inflated costs.
If you have got 200 or 300 people who are working over a period of 3 months, 4 months, and they are locked up somewhere taking course, they have to eat, they have to be fed, they have to take tea, they have to be there. What are they supposed to do? Are they not supposed to eat at some point? In the planned expenditure, 42 million shillings has been allocated for hiring of 15 ambulances, meaning 2.8 million shillings per ambulance on average. For example, the 42 million shillings, 5-point-something million out of that is tax. You take 15 ambulances, the health workers who are working in those ambulances, you put the PPEs those people are using in those ambulances, you give them 2 shifts of people because you have got 24 hours. You are in with that ambulance for 24 hours. Okay? There are 15 ambulances. You have got them for 12 weeks. That is 3 months. You know, spread that over 3 months and do the maths. Health Principal Secretary Susan Mochacha, in a statement to newsrooms, says that only part of the 1 billion shillings has been received by the ministry. That it is not true that all the money has been spent and that it will be dispensed on need basis from time to time for the program that runs from April to September this year. President Uhuru Kenyatta perturbed by allegations of misappropriation.
Wakati ukifika, it shall be audited in broad daylight. Kila shilingi, kila dururu ambayo imetumika, Wakenya waweze kujua hii pesa ilitumika kwa njia gani na kusaidia nani. We shall make it public. Hakuna kitu ambayo itafichwa. Lakini hii sio wakati ya kugombanisha. Hii ni wakati ya kuokoa maisha, jameni, tafadhali.
The Ministry of Health has since submitted a proposed budget of a further 2.3 billion shillings, which according to CS Mutahi Kagwe will be utilized in management of the virus, mainly in acquisition of testing reagents, consumables, and assorted personal protective equipment. CS Kagwe's statement to the National Assembly, however, indicated that the money would be spent before the end of the current financial year, meaning before the end of June. Kagwe also defending his character over these allegations.
I have never done any business, not only with this ministry, but with any ministry. So when I say that there are those kind of people out there spreading malicious rumors, it is true. And not that it is affecting me, because, you know, I've got my eyes on the ball.
All eyes will be on the Ministry of Health and affiliated agencies as the coronavirus pandemic attracts more donations at a time COVID-19 patients are faced with medical bills that the government says should be borne by themselves, and in case a patient is unable to foot it, they will be allowed to finance the much they can, the balance being waived as long as they are in public facilities. Sam Gituku, TV, Nairobi.